Okay, we are just going to wait for a few of the attendees to filter into the presentation tonight. Just going to give it about a minute and we'll start right at 6. Okay, just wait for a few more moments for the attendees to filter in. Okay, looks like that's it. Welcome everyone. My name is Laura Gramis. I am the Public Information Officer for Lehigh County. Primarily, I help host these weekly webinars for the Citizens Academy. This week, we are with Director of Human Services, Kay Achenbach. Before we begin, I would just like to remind everyone that today's presentation will focus on the role of human services in Lehigh County. We ask that you refrain from all questions and comments until after we are done presenting today. Any off-topic comments or questions will be withheld and we will be prompted to move on to the next attendee. So let's try to stay on topic tonight. If you wish to comment or ask a question, please use the raise your hand option to be recognized. If you're joining using the link provided on a computer or mobile phone app, you will need to use raise your hand. If you're joining us tonight by telephone, you will need to enter *9 on your phone to ask to speak. The moderator will then unmute you and let you know it is time for you to ask your question or your comment. After the question has been asked, the ability to speak will be withdrawn. Thank you, everyone. Now I'm going to pass it off to Kay. Kay, the floor is all yours.
Thank you very much, Laura. Good evening, everyone. This is Kay Achenbach. As Laura said, I am the Director of Human Services for Lehigh County. We do have a PowerPoint for you tonight. It is an extensive one. Laura's going to put it up on her screen. There we go. Thank you, Laura.
You're welcome.
We can move that right along. Many people do not understand what human services are. Human services is not welfare. They are specific services designed to assist people in difficult life situations. They help people navigate through either crisis or chronic situations where people find they need external help and guidance to move forward with their lives. It may be a crisis in that it's all of a sudden something that happens and then it is fine. Or it could be a chronic where some of our people that have disabilities would need this more on. Can you flip the page, please, Laura?
Yep, sorry about that.
Okay. The state charges the Pennsylvania counties to assist in the delivery of human services. That's why you don't see them delivered by cities or by municipalities. It is something just for counties. Human services models vary by counties. Some counties have human services reporting directly to commissioners. Some have them reporting to a human services director who reports to either commissioners or an exec if they have a home rule county. Counties can tailor their system as best meets the needs of their citizens. Some people do not have a human services director. Some might give it to a mental health and intellectual disabilities director or to a children and youth director. Some of the typical human services activities are completely optional. For instance, counties technically would not have to run aging. They have to have it, but they can put it out to a nonprofit or a provider. The same with drug and alcohol. Counties must have an MHID administrator and services. Counties must have children and youth administrator and services. So there are things that people can do, counties can do as best fits their needs. Not all counties have a county nursing home. Some have one and have it report to human services. We have one in Lehigh, but it does not report to human services. Okay, on to the next, please, Laura. This is a listing of our human services offices and the agency director that we have in charge of each one. We have the Office of Aging and Adult Services. We call it that because it actually is two offices combined. It is the Area Agency on Aging and it is the Office of Adult Services. That answers to J.R. Reed. Office of Children and Youth answers to Paula Griffin. Josh Bridges has quite a bit. He has drug and alcohol, early intervention. He has information and referral, intellectual disabilities, and mental health services. That all falls under Josh. Health Choices falls under Mr. Matt Bowder, and Office of Integrated Services falls under Sue Laterra. Integrated Services is a little bit of a different one. That is an office that we do not actually have to have, along with the Office of Information and Referral. We carve funding out from the other offices in order to support these. They don't have their own specific funding. You can turn the page, please, Laura. Some of the challenges that human services programs face is because they're in several state departments. Many of ours are in the Department of Human Services at the state level. Some are in the Pennsylvania Department of Aging, some are in the Department of Health, some are in drug and alcohol programs. So you can see when you have all of those different programs coming together, each with their own specific set of rules and regulations and funding, that is a problem. Each one of our offices has very individual program requirements, and what may be required in one is not required in another. They have individual fiscal requirements. Everybody has their own funding streams, except for the ones that, as I said, we carve out on our own. There are different confidentiality requirements, which makes it difficult for the offices in human services to work together. For example, the most extreme one is drug and alcohol, which has the 255.5 regulations, which basically say that we can't share any information. When you have someone with drug and alcohol, and you may have someone in mental health, and you may have a child in child welfare, it makes it difficult for those offices to share information. And of course, the ultimate is the funding is limited. So that also is a very tough one. Okay, next slide. I'm showing you our 2021 Lehigh County DHS expenditure budget. Now, this is the county budget, which is on a calendar fiscal year, January 1st through December 31st. But our state agencies and our individual agencies within the county report on a state fiscal year. All of us report from July 1st through June 30th of the next one. The only exception right now is Health Choices, which the state has moved into a calendar year. So that makes it a little difficult. But this shows you what our 2021 Lehigh County DHS budget is. Now, I've limited it to just the main agencies, but it is over $190 million. You can see that Health Choices is the bulk of that. We're at over 61%. Next would be Children and Youth at nearly 17%. Then we would go down to mental health, and then aging, and intellectual disabilities and early intervention. And then finally, drug and alcohol is the smallest. The next slide shows you how human services spends its money. And I've broken it into three main categories, those being our personnel costs, our operating costs, and our purchase services costs. You can see that the bulk of our money, 86.7%, goes to purchase services. 12.3% goes to personnel costs and 1% to operating. Now, I will say this is a bit misleading because of the size of Health Choices. Please don't think that, for instance, Children and Youth only puts 12% of their money into personnel. They put a much higher percentage than that. Aging does not put 12% into personnel. It is much higher than that. And that's what you would find with all of the agencies. Health Choices is very big, and almost everything is costed out. So that does tend to skew this a little bit. Next, I want to show you where our money comes from. And this is our 2021 Human Services revenue by source, again, based on the county budget. Almost 97% of our money comes from the state and federal government. 2.9%, just under 3%, comes from the county with our matching requirements, and less than 1% is program income that we may get. We are very, very heavily leveraged on intergovernmental funding. And actually, we take less than 5 cents of every county tax dollar. So even though we are the biggest departmental budget in the county, we do not use very much at all in the way of county tax dollars. We leverage those tax dollars very, very wisely. Okay, now we're going to get into our individual offices. I pretty well tried to stay to alphabetical order. Aging and Adult Services. As I said, that's the combination of two offices. It's the Area Agency on Aging, which we call the AAA, and it's the Office of Adult Services. They support and they empower the well-being of adults of all ages, 18 and up, who live in Lehigh County. When you come to aging, we have served almost 6,600 consumers. Aging would be 60 plus. They've received either direct services and or congregate meals. Almost 840 consumers age 18 to 59, those would be our adults, receive direct services. Those would be meals, personal care, home assistant, and you can see the other things that we have listed there. Okay, the next slide shows you our reports of need. And if you look at the bottom of the first set of charts, you'll see RON, that stands for reports of need. When a referral comes in, it is called an RON. Then you'll see what we've done with the under 60s that come in, and you'll see the investigations to the far right of that. Now the green, with each little cluster of bar graphs here, the green is the most recent. You can see that basically our referrals, our investigations, our reports of need all go up. 2020 with COVID did make them go down a little bit. So all except for the 60s, you'll notice that one still stayed up. Aging was one office that didn't see much of a drop in referrals because of COVID. The next slide is going to show you the number of assessments that we have done for service. If you look at the numbers up there, you'll see they're pretty high. In 2020, we did over 4,000 assessments for service. What happens is when need comes in, when a referral comes in, we do have to send a caseworker out and we do assess what kind of services they need and if they qualify. Next graph, please. This is a graph of our options services. Options are services that allow aging or older adults to stay in the home, even though they don't necessarily qualify clinically or financially for long-term supports and services. We do have funding through the Aging Block Grant to allow them to do that. It could be personal care. It could be assistance with activities of daily living. It could be meals, anything like that. We usually have to put people on a limit as to how much we can spend per month. But you can see on the chart there, it shows the average waiting list of individuals by month, because we do have a waiting list for those services. And it's the number served and the unduplicated individuals for the year. You can see that. Our Aging and Adult Services Office operates a few other programs too. One big one is our Homeless Assistance Program, what we call HAP. HAP funds are very restricted. They're limited to people who are experiencing what should be a short-term, one-time need for assistance. Someone may have fallen behind because they've broken a leg and cannot work, but they expect that they will be going back to work. So this is limited to only, you can come for assistance once, I believe it is about every 2 to 3 years, and your assistance is limited. In the last year, we've had 289 people who have had their homeless situation or their eviction resolved. We've had 16 individuals who've had true homeless situations resolved. We have helped 115 households, and those households included 213 children. It's a very good program. On the next slide, you'll see the piece that came on as a result of the CARES Act. The CARES Act money you may have heard of, it's that additional rental assistance. There is now recently a much bigger, it's no longer CARES, it's the American Rescue, but it's a much bigger part of rental that is happening. That is not this piece. This is the one that we had before. We helped 313 individuals in eviction or near homeless. We had that resolved. We helped 93 who had true homeless. We helped 133 households, and we helped 220 children in those households. That was the additional money that went to HAP. Now we move into the true rental relief program, which was $1.7 million. And you can see we dispersed almost all of that $1.7 million. We simply ran out of time. We served 796 households, and we had 317 landlords that we assisted through these monies. We do not have a slide for this, but also under Aging and Adult Services, we have Cedar View Apartments. That is a subsidized housing unit for older adults and disabled. You have to be financially eligible in order to get into that. That is about 198 apartments that we have on 10 stories. That is out near the Cedarbrook complex. Okay, Laura, if you would move on. Next, we go to Children and Youth Services, where their thoughts are protecting children and strengthening families. That is their goal, and that is what they do. Next slide, they're committed to protecting children from abuse and neglect. They're committed to maintaining children in their own home and community, ensuring access to services for parents, preserving and stabilizing families, and assuring that children have a permanent home. We have, as of this, 294 children in out-of-home care. We have 355 children in the subsidized adoption program. We have 88 children in subsidized legal custodianship. Okay, on to the next, please, Laura. We are engaged in the Family Engagement Initiative. That is designed to ensure greater inclusion of family in child welfare and decisions with children, and it is designed to keep families united. It includes 3 core areas for meaningful family engagement. Those are enhanced family finding, which is looking for additional members, supports, relatives, anyone to help with the family. It is crisis and rapid response family meetings. In other words, if there is an issue, we get someone out there to help the family and stabilize a situation quickly. And it is enhanced legal representation, which is exactly what it sounds like. Okay, next slide, please. Our Children's Roundtable has an Education Success and Truancy Prevention Committee. It's a very active committee. It is prevention and it is early intervention. It works between children and youth and the Allentown School District Truancy Program. We work with 9 elementary schools in the Allentown School District, and Children and Youth funds elementary school, home, and community-based outreach to families about truancy. We're committed to helping truancy. We're committed to getting children in school. Okay, next slide deals with our out-of-home placement practices. We have countywide enrollment training. Well, let me start back at the beginning with this. What was happening is if children were placed in out-of-home care, that could move them out of their home school district, which is disruptive to them. We are trying to, and it's a state initiative, to make sure that wherever a child is placed, they are still allowed to go to school in their home school district. Then when they are returned to home, they haven't missed anything. They've stayed with their teacher, they've stayed with their friends, they've stayed with their classmates. That is what Every Student Succeeds, or ESSA, is all about. We have done, through one of our workers, countywide enrollment training with all of our school districts. We have, through the state, the enrollment brochure that is passed out to every school district so that they know what to do and what to expect when there is a child. We do transition planning with the school district, and we have cross-county meetings of the schools, children and youth, and the providers to make sure that the child stays in their class and keeps up with their work. Laura, I think we lost the PowerPoint.
Oh, sorry about that. We got a disconnection in the system. I'll put it right back up. Sorry about that, everyone.
I'll just get started. Next, a big program is our Early Head Start or Safe Start program. That's a collaboration between community services for children and youth. It is not just a collaboration between that provider and agency. It is also a collaboration between that provider and our early intervention program. And you'll see that as we move to that slide. We have two full sites. There's a misprint here. The East Allentown site is the old state hospital grounds, and the West Allentown site is 17th and Shoe. And that adds Lehigh Valley Hospital as a third collaborative partner. This program provides all-day supportive care for 72 children identified as drug impacted at birth. It also runs an in-home parenting program offered for 20 children. It offers parent education and support. It follows children ages 0 to 3 who can then transition into the Head Start program and allows for continuum of care. This Safe Start program is absolutely wonderful to see. I have visited both of them. It is the pastel colors. It is the soft lighting. That's the way that they work with these children from the time they are tiny babies until they approach their 3rd birthday. It's a fantastic program. Okay, and our last slide for children and youth. If you are concerned about a child being either neglected or abused, please call the number that you see below. That is the state number for Childline. Childline will allow you to be anonymous, and they will refer your call and your thoughts to the county where the child resides. But that is what you do there. Okay, our next agency would be drug and alcohol. And this is basically their mantra and how they operate. They recognize the disease concept of chemical dependency. They believe that prevention and early intervention is the key to overcoming addiction. And if you look on the next page, you will see just some of the drug and alcohol specialty services. I can pick out a few and go through them, but I wouldn't have time to do all of them. We have CRS, Certified Recovery Specialists. These are people who themselves were addicted and are helping others to get out. It is very good for someone who's actually walked that path to help someone else. It's good for someone who's trying to recover to be able to look at someone next to them and say, they did it, I can too. Blue Guardian is on that list. That's a collaboration with the DA and the police, where if someone has naloxone, someone goes out within 48 hours to try to get them into help and into service. We have family intervention, which is what it sounds like. We have our TCAP program, which intervenes with court and gets someone into treatment, which is monitored in lieu of meal time. We have our SAP, or our Student Assistance Program, where workers go directly into the schools, teams, SAP teams, and they talk with the kids there and get them help if it's needed. The Naloxone program, I think everyone pretty well knows that, and you can see on down through. The latest is the 2 recovery centers that are either open or are opening in March of 2021. There was a small setback in one, but I believe it is still scheduled to open this month. Both of those recovery centers are located in the city of Allentown. Okay. On to the next. This is drug and alcohol by the numbers. And you can see over the years, the admissions into treatment. Now it is going down. You can see that. Our clients are admitted into multiple levels of care, and the levels of care are bulleted below, and they go from least restrictive to most restrictive. They range from outpatient and go all the way down to withdrawal management. Those are the levels of care that we have in drug and alcohol. The next one shows that we have a lot of success in completing evaluation on our referrals. Out of the referrals received, on average, we have an 88% success rate of getting them into a complete evaluation, which is of course the first step in getting them help. Sometimes we get referral and then someone will change their mind and doesn't want to be bothered, but we have an 88% chance of completing that eval and getting them into help. Now that's not saying they're going to complete the help, but it at least is a first step. Okay. Though the opioid epidemic has dramatically increased the rate of opioid overdose, alcohol remains the primary reason for emergency room presentation among substance use disorders. And they say the slight reduction in alcohol percentages may be due to a rise in stimulant misuse. You can see our alcohol versus opioids diagnosis. You can see the referrals for both across 4 years. And it shows you how things have changed a little bit. Things have adjusted. The last slide is our Blue Guardian slide. As I said a little earlier, that is a program where we have outreach. If someone has had an overdose reversal with naloxone within 48 hours, people go out, we try to get you into treatment. Due to COVID-19, Blue Guardian moved to telephone outreach. And in 2021, we have just started up face-to-face contact again. When a successful joint contact is made, 65% of the individuals have entered treatment. Now we've covered a few areas, and this is long because there is an awful lot with human services. Laura, would it be possible to see if there's any questions so far before
Of course. Okay, so right now we're going to take a pause in the presentation and we're going to open the floor to questions. If you're joining us by computer or mobile app, please raise your hand to request to speak. Or if you're joining us by telephone, please press *9.
Thank you. I would just rather do it this way than have somebody wait until the very end.
Of course, no problem. The floor is open again for questions. Please press raise your hand or press *9 if you're joining us by telephone to be prompted to ask a question. Okay, one more call for questions. If you'd like to join us by computer, please raise your hand with the raise your hand icon or press *9 by the telephone. Okay, final call for any questions. Okay, Kay, I'm not seeing any questions from the audience.
Okay, that's fine. Then we will continue.
No worries.
All right, our next agency that we're featuring is Early Intervention. Early Intervention serves children birth through just to their 3rd birthday that have any form of developmental delays. It could be maybe they're not holding their head up right. It could be something possibly with speech, fine motor, gross motor. There are, I believe, 6 or 7 different categories that we would look at for that. In 19 to 20, Early Intervention received almost 1,850 referrals, and that was down by several hundred due to the pandemic. Our EI office provides services designed to improve developmental and educational growth, enhance the family's ability to meet their child's needs, and it is to prevent the need for more and more costly intervention in the future. In early intervention, an initial screening or an evaluation is offered to every family. If a child is determined eligible for EI services, an individual family service plan or IFSP is developed. From the time we receive the referral until we have this plan, we can only have 45 days. We must complete all that within 45 days. The services that EI includes are service coordination, it's family training, it's special instruction, occupational therapy, physical therapy, speech and language therapy, vision and hearing supports. These are things designed to help a child get back on track. Anyone can refer a child. It could be a pediatrician, it could be a parent, it could be a preschool teacher or a childcare teacher. Anyone can refer there. Okay, some highlights from our early intervention program, fiscal year 19 to 20. Over 1,700 children were evaluated and 1,450 of those were eligible. That is 83%, which tells me that people are not referring children needlessly. There really is a delay if a child is being referred. 197 children were enrolled in our ITF, which is Infant Toddler Family Waiver. 600 children were transitioned from the county infant toddler EI program to an intermediate unit. Now, let me explain that one. I said that the county works with early intervention children from birth up until their 3rd birthday. At their 3rd birthday, they are transitioned to whatever county intermediate unit. In Lehigh County, it is IU 21. Nearby Northampton County, it is IU 20. That is where the children would go on their 3rd birthday. There is a transitional plan. Children are moved over, and then they would go also into Head Start. 349 children were discharged successfully from our program, and 100% of the children entering EI in 1920 had their evals and their IFSPs completed according to the mandated state timeline of 45 days from date of referral. That can be a tricky timeline to manage depending on how many children are coming in at any one time. Okay. Here's some of the early intervention and community collaboration. Our first one, remember with children and youth, we talked about the Safe Start program. Well, Safe Start also works with early intervention. As children come in, they may be eligible for that. They may have to go there. We work very well together with providers and across our different agencies. Safe Start is the 2 locations, as we said before, and they're the trained service coordinators assigned to each location. We have our plans of safe care that we develop for infants affected by prenatal substance exposure. That's a collaboration between children and youth, early intervention, drug and alcohol, and our local hospitals that support obstetrics. A lot of that is also coordinated through our Office of Integrated Services. They've done a great job at helping to pull our agencies together. Easter Seal Society conducts screenings and provides referrals for children in child care centers and homeless shelters. We also have Unconditional Childcare, which provides classroom coaching to child care centers to prevent children from being at risk of suspension or expulsion. We don't want a child to be in a child care center and then they are basically expelled from that program due to behavior. This next graph shows our yearly growth in early intervention. The very last bar on the far right should be 2019 to 2020. You can see we go up, except for this last year due to COVID, we are down. Okay, our next program is Health Choices. Health Choices provides for medical necessary behavioral health services to MA enrolled Lehigh County residents. Our behavioral health, whoops, that's the end.
Sorry about that.
No problem. Our behavioral health services would be mental health and drug and alcohol. That is what we are working with there. Health Choices is federally funded through the Center for Medicaid and Medicare Services, and the funding is passed through the state to each individual county. Counties may choose to keep the Health Choices program. They may also choose to opt out of it. It is called the process of county first refusal, the right of first refusal. According to the state, every county must be asked, do you want to keep and manage your Health Choices program, or do you want to pass it off to the state? Lehigh, back when Health Choices first became active in this county, said, yes, we will keep it. In 2020, our Health Choices program provided behavioral health services to over 19,000 unduplicated members and that accounted for nearly 78 million in medical claims costs. Now, to give you an idea of the scope of and size of this program, understand that we pay providers once a week for behavioral health services, which would be mental health and drug and alcohol, and for just our MA clients. Typically, we pay on average $1.4 million a week on just this. That is the size of this program, which is very staggering if you put it into perspective. The program is always looking to be innovative and create services and supports that will meet the growing and changing needs of our members. Health Choices has state initiatives, and we've listed those initiatives here. There is a tobacco cessation plan initiative that the state requires that Health Choices work with. There's our community health choices. Community health choices is moving long-term supports into a health choices or managed care setting, because in effect, that's really what it is. It's managed care. That's new to Lehigh County as of this past January. We have our opioid centers of excellence. We have transitional age youth certified peer specialist pilot program that we are to be working with. We have integrated care performance initiatives. That would be the integration of physical health care and behavioral health care. There is an antipsychotics medications dashboard for each MCO and their clients to use. This way they can keep tabs on if they're adhering to their medication and the management. If you turn, you'll see there are more state health choices initiatives. We have solutions and supports for our forensic population. We have the implementation of what we call the IBHS, or the Intensive Behavioral Health Services. That was formerly known as BHRS. We have value-based purchasing. We have telehealth, which has become particularly popular in the COVID years, but it was popular, especially with our more rural counties before COVID, because they simply do not have the providers and the options that the more urban counties have. We have the trauma-focused residential treatment facilities for our children. And we have to work with the social determinants of health. Those would be, for instance, housing, transportation, employment. We are to be working with how a lack of those social determinants or a problem with them impacts mental health or drug and alcohol treatment. Okay. Some of the innovative programming. We have our wellness recovery teams, which is a collaborative team approach to improve physical and behavioral health factors. Okay, the teams have a navigator, a nurse, behavioral health. They assess and they support the individual areas of concern. We have our countywide school-based mental health outpatient services. We partner with school districts to identify mental health needs of the student body. It creates a pool of potential providers for school districts to explore and to interview to find the best fit to meet their needs. Those are things that we do for our schools. More are specialized services to meet the varying needs of our members. That would be the next slide, please, Laura. We have intensive case management for the homeless. That is one service. We have dual diagnosis treatment teams, what we call DDTT, for those members who are both have intellectual disabilities and mental health needs. We have specialized outpatient services for members on the spectrum. We have our first episode of psychosis. We have jail diversity and reentry. Service gaps and unmet needs are assessed on an annual basis to determine if there are additional community and residential programs. What happens is our health choices manager, Matt Bowder, will go out to different groups and he will talk about things that need to happen and we will see what we can do. We also have a provider that screens for satisfaction and for additional needs. Many times people can get frustrated because they may think that, well, I've submitted this and you didn't do anything. Unfortunately, Health Choices 2 has its rules and its regulations. And we might agree with you 110% that we would like to see this happen. But if the state says you can't pay for that, then there really is nothing we can do about it. We can work, we can try. Once upon a time, trying to get some of the forensic supports in would have been very difficult. Trying to work with homeless would have been very, very difficult. But we've managed to get some of those things in. Okay. Next is our crisis intervention, information, and referral. Crisis intervention is a part of mental health, and it is an on-call 24/7 service. In addition, what counties do not have to have is INR. INR started in Lehigh County back in 1997 when folks in Human Services said it would be good to have one number to call and no wrong door. And that is what this is. In order to leverage workers, crisis intervention and INR work together. Okay, so if someone has a need or has a concern, you can call one number, 3200, and there are trained people there who can help you figure out where you need to go. They'll ask you a few questions and they'll help refer you or get you the information that you would need. That is an important part of our county, and it is not something that unfortunately every county has. In the last year, they have served 3,847 individuals. They've made 2,700 phone contacts. They've done over 200 home and community visits. We've had 19 walk-in visits. Now remember, with COVID, there were times when even our building was closed, so that is going to be lower. Our involuntary hospitalizations are over 600. Our voluntary hospitalizations are just over 400. The next few slides will give you an idea of what happens in information referral and crisis. This slide is for calls and requests that are simply information and referral. And there is a bar for 2020 and a second darker bar for 2019. You can see the information, the referral number calls that have come in for aging. They're up this year. You can see for children and youth, it is down. Early intervention, it is down. Mental health, it is down a little bit. Intellectual disabilities, it is down. And just regular information and referral. Where would I go to get something or other? That's very small, and drug and alcohol is very small. What happens is, I said there is no specific funding stream for the state to fund this. Tracking this is also a way that we fund it. You can see from the calls, they're mostly aging. So most of the cost of this, aging is picking up. A little less of that is children and youth, a tiny bit less than that would be mental health. This is how we cost that out, because this also serves as a service to our individual agencies, as well as the people calling in. The next slide is crisis intervention, and you can see the calls and referrals and tasks that they have. The biggest one, of course, is suicidal ideation or attempt. Followed by that is anger, then psychosis, depression, anxiety. Then we start getting into the smaller categories. You can see it is tracked for 2019 and again for 2020. But that gives you an idea of the calls and the requests that come into our crisis intervention. Our next slide talks about program enhancements that we have between crisis and INR, because remember, most of these people are cross-trained. We do have a community connector. We have one caseworker in that area whose job it is, if someone's having an issue, to help spend a little more time with them, connect them where they need to be. We do have a crisis incident stress management team to work with our Lehigh County employees. If there is a concern, say someone on a caseload passes away or something happens to them, Our workers are under stress, and this is very difficult for them to deal with. They can go to this crisis incident stress management team. These people are sent out to talk with them and to help them process. We do have a United Way trauma awareness. We collaborate with them and we work with them. We are a COVID resource for support, information, and referral. And the promotion is always, it's okay to not be okay. And that's our next slide. It is their picture here of it's okay to not be okay and where you can go. And here's your crisis intervention number. Here's your suicide prevention lifeline. There's your crisis text line and what to do. But that is our message. It's okay to not be okay. Someone will help you. Just reach out. Reach out on behalf of someone else if you have to. Okay, next slide would be intellectual disabilities. They believe people with disabilities have the right to plan a future for themselves based upon their preferences, beliefs, and abilities. IT continues toward community-based services. They authorize less in segregated settings and more in community supports, and they assist with finding and maintaining competitive employment. We have 315 consumers in the base family support services program. And then there are our waivers. We have three main different waivers. Person, family, direct supports, that's 323, 103 in community living waivers, and 536 in the consolidated waiver. Now, if you think back to my expenditure, my pie chart, intellectual disabilities was very small. That is because everything paid out through those three waivers in the bottom bullet runs through the state, meaning workers at the county level review the plans, authorize the services, put in for it, but then it actually goes through the state. If you were to add that money back into the county, our budget would be astronomical. And there is a slide coming forward that shows you how big that would be. Okay, next slide, please, Laura. This is some recent data from our Office of Developmental Programs, which would be the state regulatory office, the independent monitoring for the quality. And these are the results. We're very proud of these results. 90% of the individuals who responded reported that their supports coordinator helps them get what they need. 88% of individuals who responded reported that they are generally satisfied with their work, school, or activities. 100% that responded reported they're getting all or some of the services they need to live in their home or community. 96% of staff appear to recognize and support the individual they serve in ways that promote the person's independence. These are all very, very high scores for a county, and we're very proud of them. Next slide is a pie chart that shows our waiver funding, and it shows waiver by type. Remember, we had the consolidated waiver, we had the community living waiver, and we have the person family directed supports waiver. The consolidated waiver really does not have much of a cap on it. The community living waiver has, I believe it's about a $75,000 cap. And the person family directed supports is probably in the high 20s to 30s, low 30s. They change that from year to year. So I'm not quite sure of that one. On the next slide, you'll see the amount of money that is actually authorized through each of these. Our total waiver expenses for Lehigh County are over $104 million. So if you look at the fact that our budget is over $190 million and you were to add this piece in, our budget would be extremely big. Extremely. We are by far the highest in the county now. This would throw us right over the top. Now for our block grant funding, which is for those people who are not served through the waiver. You can see how we spend that money. The bulk of it, of course, goes to residential services. Okay, there is for vocational rehab, there is for day programming. This is what they pay for, and ID broke it out for everyone to see. Next slide would be their PUNS, which is the prioritization of urgency of need, or it is their waiting list. Okay, most critical would be emergency, and we have 143. These are people that we're going to have to bring into the system in probably a year or less. Then we have our critical, which is 101. We have longer to get them into the system, and then we have our planning. We may have adolescents who we know are going to have to go into services and into the system, but they're maybe only 15 years old. So they would be in that group. This is how we continually look at the number of waivers we have and how we can best meet the needs of everybody in the county. Sorry this is so long, but human services is a very big field. But we are moving toward the end. Mental health. Our mental health program believes that those with mental illness can best achieve positive change and recovery when treatment and supportive services are guided by the individual's goals, preferences, strengths, and needs. We have helped over 2,300 unduplicated county residents. One big initiative that we have is called Roommate Roundup. The problem in Allentown and in Lehigh County is rents are very, very high. Someone on SSD, SSI cannot afford an apartment by themselves. We sponsor these initiatives to get people to meet each other and work with them to decide who might live together and be successful roommates. And that way they can afford an apartment when they're sharing rent. This has now expanded to what they call Model 2.0. And that model now works with investors who are going to rent furnished homes for 4 to 5 unrelated individuals. This group meets twice a month. They support people in finding safe and affordable housing by sharing the expenses. We have a community-based intervention team that provides a format for individuals who are involved in multiple systems to have their providers and other team members available by phone to develop and monitor plans. In other words, if someone's working with several agencies or several providers, they're not working with each one individually. We have this CBIT team who brings everybody together and they're all talking together. Lehigh County Mental Health has also joined forces with Northampton County in an employment coalition that addresses employment needs for people living with serious mental illness. That group meets, I believe it's once a month. They always have their Spring into Employment event at the Northampton County Community College. They look at skill development, they look at benefit analysis, and they just have a job fair to see where they can get people jobs. Next slide shows the unduplicated people served by fiscal year. Again, due to COVID, you can see it has dropped. Mental health does forensic supports. And you can see quite a list there of things that we do to partner with jail, to partner with those that are in the judicial system. We have a long-term structured residence, which is a locked program, serves 8 individuals. We have a forensic step-down residential program. As people can be released from that LTSR, they go into this program. We have forensic certified peer specialists. Remember, we talked about them for drug and alcohol. Well, certified forensic peer specialists would be people who were at one time involved in the forensic system, because no one knows better than someone who has walked that path. We have therapists start to work with people in the jail, and then they continue the therapeutic relationship when people go into the community. And we have our community integration specialists who are police liaisons. They work with some of the police departments in the county. Okay, more forensic supports. We have a CARE program, which stands for Correction, Assessment, Reentry, Endeavor. That provides intake and assessment, counseling, psychiatric evaluations in the jail. The step-by-step mobile psychiatric rehabilitation provides treatment to individuals while they're incarcerated, and it assists people who are released in moving to independence. Our crisis intervention team has trained over 100 police officers in the county, representing 14 police departments. This is a national model of training, and it's for first responders. It was implemented in Lehigh County in 2014. That is teaching our law enforcement how to recognize and then deal effectively if they find themselves in a situation with someone who is having a mental health crisis. They, of course, call us, but we're not there immediately. This teaches police officers how to work with that. And then there is the CIT assessment that we're currently doing. We've partnered with Cedar Crest College to really begin to assess that CIT training to determine how effective it is and to make recommendations for improvement going forward. Next, we have residential housing supports. You can see the levels of care that we have on the left, and you can see some of the providers that we have on the right. State hospitals, you all are probably aware of the fact that Allentown State closed in 2010. We do have civil beds at Wernersville. We have 37 beds there. And we have our forensic beds at Norristown. There are never enough forensic beds, so we have opened the long-term structured residence that you saw in an earlier slide. Then you can see some of the other levels of care that we have and the providers that we have going down through. Next, our step-by-step Fairweather Lodge continues to support 8 individuals. It is the only program in Eastern Pennsylvania to be certified as a lodge by the International Association. This provides supports, employments. It is a national program that you can see. You can look that up and see what actually the blueprint for that is. We do have a suicide task force. We had 37 people at Wernersville. We have reduced by 71 beds in the state hospital system. Most of those were through Allentown State, but some of them were also from Wernersville. Over 40 people were diverted from going into Wernersville State by being supported in the community. Our SPORE unit has changed its name. It is now the Special Program Offering Recovery and Education. It used to be the Special Rehabilitation for Offending, no, Special Program for Offending, something like that, Rehabilitation and Education. That is a group that actually works with both adult and juvenile probation. And then we have enhanced mental health training provided to all police departments in the county. A few of our initiatives, we have the first episode of psychosis program launched last year. It's a specialty care approach to treating young people ages 15 to 30 that have recently experienced their first episode of psychosis. It's a team that works with this individual. The premise is that successfully working with an individual right away to get them onto what they need is going to help them in the long run and stabilize them much quicker. Then we have our advanced directives, which is when people already set out the treatment they want before anything happens. And that is what that does. Next, we do have a suicide task force. As I said, we work closely with the coroner's office too. We work closely with providers, Allentown Health Bureau, groups like that. And we do track our suicides so that we can more effectively look into how to treat, how to help, how to assist. You can see that with ethnicity culture, we had 7 that were Hispanic, 4 that were African American, 51 that were Caucasian in the last year. On the next slide, you'll see suicides by political subdivision. Note that Allentown was not the highest. It is Salisbury. Salisbury had the highest number of suicides. We also track it by the month of incident. On to the next slide. You can see most of their suicides occur in February. And then you can see educational level of people who have committed suicide. Most are high school graduate or GED. And finally, you can see the suicide totals from 2004 to 2020. They have gone down, but they're still way too high. And they sort of hover there. The last group I want to go over is our Integrated Services Office. Integrated Services is not required by the state. It does not have its own funding. It does not have its own set of regulations, but it is one of the offices that we determined in Lehigh County was very important. It was created originally to support the 2012 System of Care Initiative to increase the collaboration with the multi-system involved cases. This is the group, Integrated Services, that pulls together all the pieces. We may have someone with involved in children and youth, but also having some mental health, maybe with a parent or a guardian with other issues. Integrated Services is the active, very small, but very active group that pulls together all these pieces, that helps the collaboration. And you can see in one of the bullets, it's even juvenile probation. They pull all these pieces together to try to stabilize and move the individual, the family forward. They bridge the service and the communication gaps, and they provide the leadership for any cross systems projects like our limited English proficiency, our plan of safe care. Remember, that was one with children and youth, and it was early intervention, and it was drug and alcohol. All right, they provide that leadership. They're a very necessary group. If you turn to the next slide, you'll see some of the things that Integrated Services does. Another nice thing is this takes these pieces that belong in several areas and takes them away from the ownership of one area, and also frees up that other agency to not have to do it because we have it here. They're a child welfare liaison. They do the community partnerships with crisis intervention, the magisterial district, the MDJs. They work to assist families with case management and linkage services so the family does not fall further behind or further into the cracks. They do the cross systems team and integrated case management support. When we have someone that is multi-system, I believe they have a weekly meeting to work on all of this. They get all the providers, all the stakeholders at the table, and they work it out together. That is what Integrated Services does. Next slide. They're also instrumental in the youth mental health first aid. That's a training that is offered to help people recognize and effectively deal with instances of mental health in our youth. It is free to the community. If you're interested in that, there's a name and a number here to call. That is Sue Latera. She heads up Integrated Services. She will help you. I know they have put training out to, I believe it was even school librarians, to help people who actively work with children to recognize when a child is in need, when a child is approaching crisis. Next slide is our Resilient Lehigh Valley. That is a collective impact effort. It is headed up by United Way, but there are many, many support services that work with this. The backbone support is the United Way. It is the county human services. It is our school districts. It's IU21, service systems agencies. This has been identified as one of 7 pilot projects in the Attorney General's statewide trauma-informed network. They've launched their first conference in June of 19, and there is a website there, and we have the website for you. You can look it up. The strategic priorities, you can see them listed here. Provide access to resources, foster collaboration, help communities reduce risk factors. My last slide is always, what are our service needs? What's unmet? What's underserved or unserved? What should be different? What works? How can we do better? But again, as I said earlier, we still have to operate within the rules and regulations that the state puts out. We as individual people may not agree with some of the things the state requires us to do, but that is the program that the state gives us, and we have to operate within that. So Laura, I can take questions or thoughts or comments. I might not be able to answer them all. I may have to go back to agency heads, but I can certainly get the answers to you.
Okay, great. So we're going to open the floor again to questions. As mentioned previously, if you're joining us today by computer or mobile app, please press raise your hand to ask a question. If you're joining us today by telephone, please press *9. So again, we're going to open the floor to questions, and we'll give it a moment to see if anyone either raises their hand or presses *9. And again, if you're joining us by computer, make sure you press the raise hand icon to ask a question. Or if you're joining us by telephone, please press *9. Okay, another call for questions. I'm not seeing anyone on the board raise their hand. Again, if you're joining us by computer, please press raise your hand, or if you're joining us by telephone, please press *9.
Of course, if anyone thinks of questions later, you're certainly free to email me. I would have absolutely no problem with that.
And I also would like to remind everyone that you're going to be receiving a follow-up email on the next day, and it will have a copy of this presentation. So if you have any questions about referring back to a particular slide, that information will be on hand for you. Okay, I'm not seeing any hands being raised. One last call for questions. Again, please raise your hand if you're joining us by computer, or press *9 by telephone. Okay, I don't see any questions from the audience, Kate. Do you have any final comments you would like to add or anything else before we wrap up?
Not really. Zoom is very difficult. I would rather be sitting around a table with people and feeling like I'm talking with them instead of talking at a computer screen. I would hope if any of you have questions, please let me know, because I'm not in a position with Zoom to talk with you. And I like to talk with people. Human services is a very, very important thing that we do. Our workers are very hard, very important jobs. They're here to serve, but they can't do everything. Okay, none of us can do everything. But if you have any questions, please let Laura know, or please let me know. I will do my best to get it answered. I thank you very much for your time and your attention.
And I think everyone as well, thank you for joining tonight's session. Next week on March 18th, we will be having Director of General Services, Rich Mulchaney. Please be on the lookout for that registration link in the coming days for you to join. Again, I thank everyone for joining us today for tonight's session. Have a good night, everyone.